Hello, Dimsdale. I'm Jet You Betcha with today's editorial, which technically makes it a Jetatorial. Kentucky Governor Andy Beshear issued an executive order banning the use of conversion therapy on minors, citing it as harmful and discredited. The order came after multiple failed attempts to pass legislation on the matter in the Republican-controlled state legislature. Beshear emphasized that conversion therapy has no scientific basis and increases the risks of suicide and depression. The executive order prohibits using state or federal funds for the therapy and grants the state's licensure board authority to take disciplinary action against violators. Kentucky joins at least 23 other states that ban conversion therapy for minors. LGBTQ+ activists, including Chris Hartman of the Fairness Campaign, praised the move as a necessary step to protect youth. In other developments, General Motors will offer adapters enabling its electric vehicle owners to access over 17,800 Tesla superchargers in the U.S. for $225 through GM brand apps. This expands GM EV owners' access to more than 231,800 public Level 2 and DC fast chargers in North America. Initially available in the U.S., adapters will roll out to Canadian customers later this year. Tesla's network is also available to Ford and Rivian EVs with adapters provided by those companies. This move supports President Biden's goal of expanding EV infrastructure and increasing electric vehicle sales to 50% by 2030. In other updates, the U.S. State Department has launched a fully accessible online passport renewal program, allowing millions of Americans to renew their passports without paper applications or in-person visits. Eligible U.S. citizens aged 25 and older with expired or soon-to-expire passports from the last 5 years can now apply online. The process includes uploading a digital photo, entering passport details, and paying with a debit or credit card. This modernized system eliminates the need for mailing documents and offers routine processing times of 6 to 8 weeks. The program was introduced after a successful pilot phase, which had been temporarily paused due to high demand. In another update, the FDA has expanded the approval of Kisqali, a drug made by Novartis, for use in patients with HR-positive, HER2-negative early-stage breast cancer. Previously approved only for metastatic cancer, Kisqali now offers a new option to help prevent recurrence. Clinical trials showed it reduced the risk of cancer returning by up to 28.5% after 4 years when added to standard treatments. While Kisqali is costly, expanded insurance coverage may reduce patient expenses. The drug may have fewer side effects than similar medications, but further data on long-term outcomes is needed. From all of us here, stay classy, Dimsdale.